Good morning. Welcome to our Teen Life Skills program. With our topic this morning is first aid. We have with us Tracy Hazel, and she is with Advanced Training and Consulting LLC up in Michigan. And we are going to be listening to her she is going to be giving us all of the information we need to know. Part of the reason we put this together is because a lot of you guys are still teens or possibly younger, and you could be home over the summertime, and you could be taking care of a younger sibling. Sometimes mom and dad might be out working still, and so the older siblings are taking care of the younger siblings. Or just like DC, you said you're from Northumberland County in Ontario, and you were late because you're finishing up farm chores. Well, I'm in the middle of farm chores outside. I got to step away to sit here and chat with you all. So we know that a lot of times our first aid skills come in handy. So it's important for us to know what they are and to professionally know what they are, because we know that there's sometimes a lot of people's thoughts about what is good for first aid, but then there's what's really is good for first aid. So I'm going to turn this over to Tracy, and I'm going to stop speaking, and I'm going to let her take over and go ahead and chat and talk to us. Thank you, Tracy.
All right. Thank you so much also for having me today. Can you hear me okay? Can you hear me okay? All right.
Yep, I got you okay.
Okay, wonderful. So I appreciate this opportunity. I think this is so unique and interesting with all the different people that we have, not just from the United States, but throughout the world. So this is really cool for me. So I appreciate this opportunity. Real quick, before we get into some basic first aid skills and some few things that you can hopefully remember in the event that something should happen, I would like to real quick introduce myself and just tell you a little bit about my background and my history. So again, my name is Tracy Hazel, and I am an American Red Cross health and safety instructor. So what that means is I teach people classes from new babysitter training to home alone safety to CPR, first aid, and even teaching people how to use an AED. And if you don't know what an AED is, I actually brought one of these devices. It's a training device that if we have time in our presentation, I'm going to talk about the fundamentals, the basics on how to use this life-saving device. But before we get into that, some of the topics that we're going to cover, we're going to talk about before providing care in your decision to act. Now, that is a critical link in the cardiac chain of survival. For example, if someone's having a heart attack, or if there's some type of sudden illness, maybe a stroke or a diabetic emergency. So we're going to talk about your decision to act and before providing care, some of the key and critical links to keep you safe during an emergency. So we're going to start out and talk a little bit about that. We're also going to talk a little bit about recognizing emergency, when to call for help, how to call for help. We're going to talk about the 3 emergency action steps: check, call, care. And we're going to talk also about recognizing and caring for a cardiac emergency, such as a sudden cardiac arrest or a heart attack, sudden illnesses such as diabetic emergencies, severe bleeding, and things like that. So when I introduced myself, I said that I was a health and safety instructor for the American Red Cross. So what exactly is the American Red Cross? Does anybody know or recognize the symbol? I have it here on my shirt. Do you know? Would anybody be willing to maybe in the chat box put down what you think this organization does?
So if you guys want to put in the chat, I can read your answer. If you would like to unmute yourself, you can. And some of you that are not in this country, I don't know if you know or familiar with what the Red Cross is. Sammy said saves lives.
Okay. All right.
And we have Wendy said, I would think it's similar to St. John's ambulance, St. John ambulance. We had now, good job, Onyx. We said they provide medical aid, and Lorena said they respond to emergencies both in America, maybe providing disaster relief, but also in other countries. And then
Okay.
DC said, I'm from Canada, so I don't know.
Okay. Okay, that is fair. So I love those answers. Almost spot on, exactly right. All the answers. Now the answer from Canada, I do tell you, I want to tell you that the American Red Cross, a humanitarian organization that provides relief when there's a disaster, they'll come. They'll provide support, maybe housing, food, and shelter during disasters. We also teach people first aid, CPR, other life-saving skills, and we also collect blood. And I know that sounds maybe a little scary or a little overwhelming, but in the event of a major disaster where people are severely injured, it is possible that someone may need a donation of blood to save their life. And when someone donates blood to the American Red Cross, that can actually save up to 3 people's lives. So the American Red Cross is actually an international, it's a worldwide symbol that people recognize as a humanitarian aid. So with that being said, let's talk a little bit about saving lives and basic first aid. When I'm teaching this class to students, I will often ask my students, what are some barriers or what are some reasons why people may choose not to respond during a medical emergency? So what I mean by that question is, if you see that something was wrong, like someone suddenly slumped over, or maybe someone has a bone sticking through their skin, what would be a reason why you may choose not to respond? So, so the Swiss flag is very similar in the chat box, by the way, to the Red Cross, but it is a different logo completely. But it is one of the most recognized logos in the world for humanitarian aid and, during time of war and conflict. Okay, I love that answer, Onyx. In the chat box, we have, you don't want to take responsibility if something goes wrong, going back to reasons why people may choose not to respond during an emergency. That is one of the most common reasons that I have students respond, the fear of maybe doing something wrong or knowing exactly what to do. So the fear of making the situation worse. I can tell you that if you recognize that something's wrong with someone, you are the critical link in that chain of survival. That in some cases, minutes matter, especially when we start talking about sudden illness or when people are, bleeding severely. So it becomes critical that you can recognize that something's wrong. Taking classes like this or taking more advanced classes, maybe through the American Red Cross website, can help give you skills and help give you that practice so that if something should happen. But I will tell you that even if you don't know exactly what to do, by simply reassuring someone that they're going to be okay and calling for help, calling, in our case here in the United States, we would call 911 or a local emergency services, and getting someone there quickly can help save lives. In some cases here in the United States, people may have a fear of being sued fear of lawsuits. And here in the United States and in the state of Michigan, where I'm from, we have lots of laws that are called Good Samaritan laws. And these are laws that were really enacted in the United States to give legal protection for people who decide to act. So I'm unsure what area, that you're from, if you have specific laws. I know that Canada and some other countries do have very similar type of protective laws that in the event you should aid or assist. But the best thing you could do during an emergency, if someone is fully conscious, is to ask permission to give care. So by simply asking, hey, are you okay? Are you all right? And if they say, no, I'm not feeling well, or, I have this trouble, I'm bleeding profusely, can you help me? That is generally a form of legal protection for you if you decide to aid or assist. We have another chat here, the fear of being sued, the bystander effect, the concerns about making things worse. It is mentioned here, we have laws that protect rescuers from negligence, but many things are considered. Yes, that is correct. So no matter what level of your decision to care, whether it's just recognizing something is wrong and acting quickly and calling for help, you don't want to go above and beyond what you're trained to do. So for example, today, if I trained you that the best way to control severe bleeding is applying direct pressure with a clean gauze, sterile, dressing with some gloves, and you chose to chop off their arm or something, that's going way above and beyond, and that could be found negligent. So you don't want to do things either you're not trained to do, you're not equipped to do, or you're not authorized to do. So you want to be real careful with your scope or level of assistance. But, I think before we get any further into our level of care or how would we care for someone who is injured or ill, I think it's important that we talk about the 3 basic emergency action steps. And when I train people in CPR and first aid, we talk about, through the use and the guidance with the Red Cross material, the 3 emergency action steps: check, call, care. Has anybody heard these 3 steps before when responding to an emergency?
I don't even know if I've heard those put that way.
Okay. All right. So DC says yes. And these 3 steps, if you don't remember anything else that I say today during this time, I really want you to focus on these 3 things during an emergency. When you recognize that something's wrong, whether you hear something, you see something, maybe you smell something like smoke or fire, the first thing you need to do is check the scene and make sure it's safe for you to be there. Here in the United States, we have an organization that's called OSHA. That's the Occupational Safety and Health Administration. And according to OSHA, 62% of the people who die on the job are would-be rescuers. These are people who recognize that something was wrong and then raced in there quickly to help that person, and then became a victim themselves, that they actually died as a result of the emergency that they were trying to help somebody else. So the first thing you need to do during an emergency is check the scene. Make sure it's safe for you to be there. You're looking for down power lines, spilled chemicals, people with weapons, how many victims there are. there's lots of factors that you need to consider before you decide to help that person. And if there's too many victims or there's people with weapons, this is not a safe place for you to be. What I would want you to do at this time is to leave that area and call for help somewhere else. So you need to check the scene. And then if you find that the scene is safe, you need to next check the person who's injured or ill. So check the victim. Does anybody know the way that you can check a person to determine if they're conscious or responsive? Does anybody know how you do that in an emergency situation? So you check the scene, you're making sure it's safe for you to be there. You determine it's safe, and that next you're gonna check the victim for responsiveness. Does anybody know how to do that? Yes. Okay. So the best way to do this, if you know the victim's name, what you need to do is you need to say, hey, use your voice. Are you okay? And then first you need to tap and shout, are you okay? Are you all right? And if the person is unresponsive, also known as being unconscious, this should be considered a life-threatening emergency. And we should call for help for that. And here, in my area, we would call 911. Or if we were in a workplace, they may have a slightly different emergency contact number to call, maybe plant security or maybe a nurse station. And that would be where we would report an emergency. So if you had an emergency where you are right now, would you know how to call for help?
I know for me, yes, I would call 911 from here.
Okay.
So I'm curious where everybody else would call.
Yes, Malaysia, London, Canada.
Yeah, I'm very curious. All right, so DC said 911. Lorena said 999. Suro said 911.
Okay.
Suro's from Montreal and Lorena from London. I always have to go back and remember where everybody's from.
Okay.
Or 111 for less dire emergencies. Ah.
Oh, that's very interesting. See, I'm learning as we're learning today. This is wonderful. I'm really glad that I asked this question, because becoming familiar with how and where you need to call for that help is critical. Again, it's a critical link in that survival. So first we need to recognize that something's wrong, check the scene, check the victim for help, and we need to call for help. We add also, when we are asking people if we are able to do so, if other people are in the area, in our case, we would say, call 911 and grab the AED. So this here again is the automated external defibrillator. And when the AED becomes available at the emergency, if you're trained, which I'm going to show you how to use this today, you will be trained, how easy it is to use this, but how much this saves people's lives if they are in a sudden cardiac arrest. So the care part. So that's where we get the check, call, care. So we're going to practice and talk about today how to care for different conditions or situations that you may come across during an emergency situation. So those are the 3 steps that I want you to remember. So I'm going to repeat those again. Check, call, care. So let's give a hypothetical scenario. Let's say that you and your friend are walking down the road, and then all of a sudden your friend falls over and you're like, oh man, not again. No, I'm just kidding. Hopefully that's not happening all the time. But let's say that suddenly your friend slumps over. You recognize that that's an emergency. That's not normal. So you check the scene, you make sure it's safe for you to be there. There's no down power lines, spilled chemicals, or other reasons why you should not be there. If the scene is safe for you to do so, I need you to check your friend. And you do that by saying their name. If it's a stranger to you, that's okay. You can say, hey, are you okay? Are you all right? And if you can do so, I would like you to tap and shout on the person's shoulder or the foot maybe closest to you. So you check the scene, you check the victim for responsiveness, you call for help, call for the AED, and I'll tell you how this works in a few minutes, and then start caring for conditions you find. So this is the part I'm going to ask. Does anybody have any questions before we get more into caring for and recognizing a cardiac emergency or the bleeding skills? Anybody have any questions so far? And if not, that's okay. Because I have a question for you. I want to know, do you think a sudden cardiac arrest and a heart attack, do you think that that's the same thing, or are those two separate events? So is the sudden cardiac arrest and a heart attack same thing or different? Okay. All right. Here it is. It is possible that someone could have a heart attack and not even know it. But when someone has a sudden cardiac arrest, which is a different event that's associated with the heart, when someone has a sudden cardiac arrest, that's when they become unconscious. They're unable to speak to us. And this is when someone needs CPR. So currently with the American Red Cross, CPR is needed for someone who is in sudden cardiac arrest, who is no longer pumping oxygen-rich blood to the vital organs. And if we recognize this type of sudden illness or this type of emergency, we would want to begin 30 chest compressions and 2 breaths. And we would continue 30 chest compressions and 2 breaths over and over and over until the victim becomes conscious, the scene becomes unsafe, you're too tired to continue, someone is trained and they relieve you, like an outside ambulance comes to relieve you, or an AED readily becomes available, and every 2 minutes, if you have the pads hooked up onto this victim's chest, onto their dry bare chest, every 2 minutes, the AED will prompt you to stop doing CPR so that it can analyze the victim's heart, and then it will prompt you to either deliver a shock to the victim or to continue CPR. So when I asked about recognizing a cardiac emergency and if heart attacks and sudden cardiac arrests were the same thing, or if they were different, they both involve the heart, but one requires CPR and the other does not. Okay. But let me talk a little bit about that. Here in the United States and where I live in Michigan, statistically, 1 out of every 3 people dies as a result of a cardiac emergency. Nearly 1 million people lose their lives every year in the United States as a result of a cardiac emergency. And this could be a situation where maybe someone was having a heart attack and they didn't even know that they were having a cardiac emergency. And it is possible that someone could have a heart attack, and if left untreated, if someone doesn't recognize the signs and symptoms of this, or the person themselves don't recognize the signs and symptoms, it could lead into that situation where they need CPR. So tell me a little bit about heart attacks. What do you know? What are some of the signs and symptoms if someone was having a heart attack? Does anybody know? Okay, so let's talk about it. Okay. Okay. All right. All right. So some answers are coming into the chat box. Tingling in the arm, severe pain, often related to the front of the chest, heavy pressure in the chest, numbness or tingling that may run down into the arm. They often talk about nausea and vomiting, shortness of breath. These are all correct answers. It is possible also, Onyx, that a person's heart could stop beating with a heart attack, or that it's not beating correctly. So our hearts, in some cases, can get off rhythm and go into different heart rhythms, like V-tachycardia, where the heart's beating super fast, or in some cases, it could completely flatline. This is called asystole, where there's no activity in the heart at all. So these are very serious cardiac events that could lead to sudden death if we don't recognize that someone possibly is having a heart attack and call for help, or begin CPR immediately in the event that someone goes into sudden cardiac arrest. So now we've talked about some very generalized heart attack symptoms that are often associated with men or with males. Okay, so through the science and through the ages and through investigation and study, there's a lot of evidence to suggest that men and women may experience slightly different signs and symptoms of a heart attack. And so I think it's important to talk about all the signs and symptoms, particularly here in the United States. More women statistically die from heart attacks than men. And I really truly feel that the reason for that statistic is that women may completely different have different signs and symptoms that we've never really talked about before, or we never trained or communicated about. And for a woman, their number one sign and symptom could be pain in the face or jaw, or pain that radiates in their back between their shoulders. Now, it is said that both men and women often have nausea, flu-like symptoms where they're generally not feeling well. And that could also include extreme heartburn that doesn't go away with a normal antacid. So signs and symptoms, recognizing signs and symptoms. It is important that if you think someone is having a heart attack, that you sit them down right where they're at. If you try to walk them across the hall and into another room, it's possible that the exertion that it takes on a heart to do that could make the situation worse. So if you suspect that someone is having a sudden illness, I want you to sit them down right where they're at and rest assured, tell them that everything's going to be okay. because simply talking to a person can help save lives. So by gathering information, you can ask them, what are your signs and symptoms? Do you have any allergies? Are you on any medications? Are you experiencing any pain? You can even ask them, when was the last time you ate? One of the sudden illnesses that I wanted to cover today with our time together, not only the recognition of a heart attack and sudden cardiac arrest, but was diabetes. I wanted to talk to you about a diabetic emergency and a sudden illness called stroke, and how we use the acronym FAST, F-A-S-T, to recognize that sudden illness. So let's get back. Let's talk first about diabetic emergencies. So it is possible that when I talk about diabetes or having a diabetic emergency, that you are already familiar with this type of sudden illness. It is a growing type of sudden illness that we have here in the States, where literally millions of new cases of diabetes are happening every year throughout our country. So when we talk about having a diabetic emergency, this is the situation where someone's the sugar, the glucose, the blood sugar is off for that person. And when I say off, someone's blood sugar can be low, and that term is called a hypoglycemic, or their blood sugar can be very high, which is called a hyperglycemic. Now, I know that diabetes is very complicated, and there's a lot of information and education that you have to have. If you are a diabetic yourself, or you know or live or love someone who has diabetes, you may need to know a little bit more about this sudden illness than what we're going to talk about right now. You do not need to know whether someone is high or low blood sugar to help someone who's having a diabetic emergency. Okay. Our basic sudden illness care, when we talk about how do we help someone who's having a diabetic emergency? Well, first you need to check the scene. Next, you need to check the victim, ask them, can I help you? Are you feeling okay? And maybe you've noticed on a medical alert tag or bracelet that they're a diabetic. And if by talking to them, you realize that they're having a sudden illness, you can ask them, when was the last time you ate? Or is it okay if I give you some form of sugar, or can help you by getting you maybe a little granulated sugar packet, those little packets of sugar, and you can put that in a little Dixie cup of water and give that person who's having that type of sudden illness some form of sugar. And that could be some form of juice or a piece of candy. But you would only do this type of care for a diabetic if they were fully conscious. In the event that someone is unconscious or their condition continues to get worse, you need to call for help, call for an ambulance. And it is possible that their care is beyond your basic first aid or your basic scope of training. It is possible that they may need things like insulin or other advanced care that we're not able to provide. It is within our scope, within this training that we're having together right now, completely okay for you to ask them, are you okay? And can I help? And then offer them some form of sugar. At that point, if you offer someone who's having a diabetic emergency some form of sugar, you want to monitor their condition. And in some cases, particularly if they're low blood sugar, you're going to see almost an immediate change in the way that that person feels, the way the person may be acting. I don't know if you've ever heard the term hangry, but even if you are not a diabetic, it is possible that we suffer from high and low blood sugars throughout the day. And it is possible, if you haven't eaten in a while, that you may feel a bit grumpy, or you may feel better after you've ate something. And that could be a low blood sugar situation. So hopefully we're able to recognize this type of sudden illness and then act quickly before it becomes a potentially life-threatening emergency. So we have a few minutes of time, and I want to talk just real quick about potentially life-threatening emergencies when you should call for help. And that is anytime that someone is unconscious or unable to respond to you. I call another condition unusually confused. And I say it like that because let's just admit it. Sometimes people are just confused. But when you recognize that someone is having trouble, maybe they don't remember their name or where they're at, and they generally look confused, that maybe we should call for help for that. Other situations where someone's been electrocuted, where someone's been burned horribly, where you have a bone sticking through the skin. These are all conditions that we cannot treat at home, at the workplace, or in our community centers. So these would be events that we would need extra help for. I want to talk to you about the AED, the quick components and how to use an AED before our time is up. But does anybody have any questions or want to comment about anything that I've talked about so far?
So I was going to add real quick that for some of you, I forgot to ask everybody's age. If you guys can put that in the chat, that would be great. Some of you might think some of this stuff is like you're not gonna run in, you might not run into something like this because you guys are young. But I will tell you that more and more youth are having issues where you might be out playing sports and they collapse. You might I will just mention, like Tracy was talking about diabetes. Some people don't even know that they're actually diabetic. And I have a friend that their daughter was 2, and all of a sudden she acted really weird one day. They ended up going to the hospital because she was just really weird, and come to find out she was diabetic. And they had no clue. There were some things that were happening beforehand. They're trying to figure out what it was, but any of your friends can, diabetes is not it's something people discover a lot. They don't know that they're diabetic. Stuff feels wrong and they go to the doctor and they get looked at and they come to find out they're diabetic. But not everybody goes to the doctor. So not everybody finds that out. So I just want to tell you guys, I know here in the US, the AEDs that Tracy's talking about, there are gyms and schools that have them. I don't know if other places abroad have them readily available. They're working here to get them more readily available, but many times you will get very tired doing CPR. So the AED, at least, it makes a huge difference. They find so many more lives are saved through having the AED and having somebody that knows how to use it. So even for your friends that might be 15, I know I'm in the South, and I will just say drugs are more prevalent with a lot of the younger generation. And we are a first responder household, so we get all the calls that come in, we hear them all, and there's very, very many unconscious calls that come in. And I have friends who their daughters go to school, and classmate just fell over and collapsed. Come to find out, I mean, it might have, but in school, because some kids are going to the bathroom and they're smoking stuff they're not supposed to smoke, and they're having reactions to things they're not supposed to have. And they're in the school, they're walking through the hallway and they collapse. I will tell you guys, 2 years ago, I was at an Easter celebration at one of the churches, and it was the Easter egg hunt they were doing for the community. And all of a sudden, somebody said, "Oh, she's collapsed." And I turned around, and we were in a group of people, and a lady that was epileptic just had a seizure like right behind me. And at least I knew what to do. Like, we gave her space. You know, the pastor's wife was a nurse, and she jumped in real quick and put something under her head. They put her on her side. And then I was having to clear the room because we needed, somebody else called 911. We need to clear the room so that the ambulance and the emergency crew has time to come in and they have space. It's not like everybody stand there and watch. It's everybody needs to clear. And so it's kind of the more and more we see this more and more.
A sudden illness.
Just a sudden,
Yep. And remaining calm, asking people if you can help, reassuring them that help is on the way, having other people, if they're able to help you, that's a big part of it. Sending people, to go meet the outside ambulance, to get to that person.
Sometimes that is a very important part. Sometimes it's very important, sending somebody to the road so that the ambulance doesn't waste time trying to figure out where they're going.
That's a critical link in all of this. Absolutely. I wanted to tell you about stroke recognition and then AED real quick. Strokes, when we talk about strokes, the number one reason why someone may have a stroke, the number one criteria, generally speaking, is age. Age, stress, smoking cigarettes, also injuries though to the head can cause this sudden illness that claims a lot of lives across not only the United States, but in the world. So if someone was having a stroke, this type of sudden illness, first you may recognize that something is wrong with the person, but this acronym, FAST, and I don't know if you want to put it in the chat box, FAST. You can use this basic first aid skill, this acronym FAST, to help recognize this potential life-threatening emergency. And F, if you think someone's having a stroke, look at their face. Ask the person to smile. See, you're going to ask them to smile. You're going to look to see if there's any droopy or numbness or part of their face that seems to be relaxed more so than the other side of their face. So fast, look at their face. Ask them to smile. A stands for arms. If you think someone is having a stroke, ask them to raise both arms. And if you find that one side of their body appears to be paralyzed or sloops or droops down more the same side as their face, that's a good indicator that they are having a life-threatening emergency known as a stroke. So F is for face, A is for arms, S stands for speech. When someone has had a stroke, often their speech is affected. This is called aphasia, and it may be hard to understand the person. It may be hard to recognize or really fully realize that this is an emergency. You might think that someone is mumbling to you. So if you ask them to F, look at their face and smile, A, raise their arms, S, I want you to speak to them. I want you to talk and ask questions. This can lead you to believe that this person's had a stroke. And T in FAST stands for time. Time is of the essence, folks. When someone is having a stroke, we need to get them medical help right away, immediately, because for every minute that goes by, severe damages can occur to the human body and to the brain. And so we need to get them advanced medication, call an ambulance. Usually that is the quickest, fastest way. And in some guidelines for basic first aid, they also recommend when someone's having signs and symptom of a heart attack or a stroke, offer the person aspirin. You would have them sit down right where they're at, call for help. And if you ask them, is there any reason why you can't have aspirin, you're not allergic to it, then that is the new guidelines, that simply giving someone one adult aspirin in their mouth, you hand it to them, they're able to take it on their own because you don't want to administer any type of medication. You are assisting one adult aspirin or 2 baby aspirins, and then have them chew it up and have them wait. And then you would just, comfort them, reassure them that help is on the way. So we have a few minutes. Let's talk about the AED, the automated external defibrillator. Out of all the basic first aid skills, and trust me, we could talk about this topic for 4 hours or 8 hours straight, whether we're talking about controlling severe bleeding with direct pressure or how do we treat burns. I feel that the topic of an AED is most important. Why? Because when someone needs CPR, and if we're able to give them CPR, their chances of survival statistically is only 5.5 to 7% chance of survival with CPR alone. But when you couple effective CPR, which is 30 chest compressions and 2 breaths over and over and over, if you couple that with a shock from a defibrillator, those chances of survival increase to 82%
Mm-hmm.
for that victim. So it becomes critical that we have people who are trained in how to use this life-saving equipment, but more so people like you who may be willing to act. Your decision to respond could save someone's life. So are you authorized to use this AED? Absolutely. Even with the level amount of training that you have right now, absolutely. The way that you use an AED, folks, is you ask for it, right? In a community setting, let's say you're in a shopping mall, a church, a school, you're always going to ask for one, even if you don't know there is one there or not. That's just part of the cardiac chain of survival. You recognize that something's wrong, check the scene, check the victim, call for help, call for an AED. Now, if someone is laying on the floor or they're unconscious and they need CPR, it would be a situation where they're unresponsive and they're not breathing. If a person is unresponsive and not breathing, they need the AED hooked up to them as soon as possible. And the way that we do that is, first, we're going to bring the AED to the emergency, and there's typically 2 buttons on an AED. One button says on and off, and the other is shock 'em. So it doesn't matter the make, model, color, or size of an AED. The fundamentals and how they work are exactly the same. So let's say that someone has started CPR and someone is doing 30 chest compressions and 2 breaths to a victim, or if they're unwilling or unable to give those breaths, maybe they're just doing continuous chest compressions. If you have an AED, the first thing you need to do is you need to turn the unit on. That's how you use the AED. Next, the AED will give you prompts on how to use it. Some AEDs will say, remain calm, call for help. Next, they'll say, apply pads to the victim's dry, bare chest as shown. So when you turn on the AED, it will continue to tell you over and over and over. It will say, apply pads to the victim's dry, bare chest as shown. So next, you would bare the victim's chest and you would apply 1 pad on the upper right victim's chest and lower left. Next, the AED would tell you, don't touch the patient. Analyzing the victim's heart. So you would tell everyone, stand clear, don't touch the patient. The AED will tell you what to do next. It will say, shock advised, stand clear. And only then will an AED load up the energy in order for you to deliver that shock. So you cannot deliver a shock to someone in most cases, most of the time, in most community type of AEDs, unless you actually hit the button and deliver the shock as needed or necessary. If you do not have the pads on the victim, or you are trying to bare the victim's chest to get the pads on, there's no way to accidentally say, step on the shock button or do something that it doesn't want you to do. It's going to continue to give you the prompts over and over and over until you do what it wants you to do. So let's take a look here at an AED in action. And you'll notice what it says in the beginning. Hopefully your real AED won't say this. Let's see.
This is a training device only. No shock will be delivered. Remove clothing from person's chest. Attach pads firmly to person's chest as shown.
And because I have not attached the pads, it will continue to give me these prompts
Plug in connector.
until I do what it wants me to do.
Check connector and pads.
There should be no fear on using an AED or
Check connector and pads.
the thought that you have to have a ton of additional training. I do know that the fear of doing something wrong or the fear of not knowing what to do is this topic, the use of an AED. I know some people think that, you know, you may not be trained or authorized, but in an emergency, remember the 3 emergency action steps: check, call, care, and you could save a life. Always ask for an AED. There could be one there, and if a shock is needed, in between you and other responders, it's possible that you could use this life-saving device.
I have one question real quick on the AED. I don't know if I remember this from when my firefighter had his first aid training. Women wear bras.
Mhm.
If the bra is a
Underwear.
underwire, is there
Mhm.
is there something we should make a difference with on that?
All right, we should just try to take everything completely off the chest if we can, all clothing and articles.
Okay.
If they have a big necklace or embedded jewelry or piercings, when we place the pads, we just want to try to avoid contact with any piercings or any underwire if it should happen to be there. We don't want to take the time to remove any type of piercings or, you know, the dermal piercings or anything like that. But if they have a big necklace or something, then we could just move it out of the way. That would be best. The key and critical thing is when the AED is on and the pads are on the victim's dry, bare chest, when it says, don't touch the patient to analyze, because we don't want it to read our heart rate or our rhythm by touching them. And then the second thing is if a shock is advised and it says stand clear, I do not want you to touch the victim. I want you to say, stand clear, everyone stand clear, then hit the shock button. And the AED will automatically then tell you to begin 5 cycles or 2 minutes of CPR before it will prompt you again to stop to reanalyze. That's a great question. Do we have any other questions? I know our time, we've talked, I try to shove as much information in 1 hour, but I value everyone's time here today. So, and I'm happy to stay on after.
Because then you keep those pads on and you do CPR still, right? So those
The
just to
entire
make sure-
time.
Yeah, right, the entire time.
Yes. even if the person becomes conscious and sits up and says, what's going on here? Which 82% of the time after the first shock, the person will sit up and say, like, where's my clothes, or what's going on, because they became unconscious, unaware of the incident. We want to keep those pads on the victim, and those pads go with an outside ambulance, and we would need to replace those pads as a one-time use.
Okay, and then I know we have a question in the chat, but question would be, so let's say their chest is dry. What if the rest, let's say their swim trunks are still wet?
That's
Or-
okay.
Okay, I'm like, if
That's
they're
okay.
laying on the pool deck, I mean, and
Yep.
I'm just,
Yes, you can use an AED during inclement weather through snow and rain. The key is we want to try to keep the pads dry, and electricity travels from one pad to the other pad and back to the other. There's no significant amount of electricity that passes through the abdomen or out and into the surface of where you're
Okay.
at. We can use AEDs on noticeably pregnant women, little baby infants and children. I would recommend pediatric pads if you have them. If they're too large and they touch, I want you to put one pad on the front of the little baby infant and one on the back, front to back. So we can use an AED in almost every environment for almost every person, even with an internal pacemaker defibrillator. The worst case, the AED will say, remain calm, call for
because
help.
I think the AED can sense some of that
Yes.
too,
And
right?
it will not prompt us to shock them. So
Right.
Debbie has a question in
Yes.
the chat that says, can you hurt someone if shock isn't needed? No, because the unit won't even charge up in order for you to deliver shock. If a shock is deemed necessary, that means you have the pads placed on the victim's dry, bare chest as shown, and it's analyzed and it deemed a shock was necessary. It recognizes irregular heart rhythm that has prompted us as responders to deliver shock. So then you'll hear the unit actually charge up. The second button, the shock button, usually makes a loud noise and alarm, and it will say unit charged. Hit the shock button now, and it will continue to prompt to deliver the shock only when it's deemed necessary. If no shock is advised, or the AED only wants you to do CPR, it will never even charge. And you can accidentally, like, say you during an emergency accidentally stepped on the shock button, not going to deliver a shock if it's not ready or deemed necessary. That's a great question.
Mhm.
I know our time is up.
All right, anybody have any other questions that they'd want to ask?
I really would like to connect with everyone if possible.
Oh, yes, put your information please in the chat.
Okay. Through my business page, I'm trying to grow my international following on my Facebook. Any type of connection or way that you think that I might be able to assist or help. If I don't know the answer, there's lots of resources available, whether it's through the American Red Cross website or OSHA.gov. There's lots of resources. So,
Yeah, go ahead and just put it in the chat.
okay.
And what I will do is I'll also email it to everybody that that had RSVP'd as well,
Excellent.
so
Thank
that
you
they can have an
so
update to
much.
that with link to the video.
Well, thank you very much for this opportunity and to connect. This has been a lot of fun. Do you have a lot of the same regular students